Hello, my name is Luan Vo. I'm with Friends for International TB Relief, based out of Hanoi, Vietnam. With regards to the question of what needs to change to make TB elimination a reality, I think I will need to borrow a framework from Professor Nguyen Quang Nguyen, former Vietnam NTP manager. This framework calls for 4 innovations that are needed to end TB in Vietnam, but these innovations may as well apply for the rest of the world. These 4 innovations encompass innovations of technology, approach, financing, and ultimately of thinking. With respect to innovations in technology, we need greater uptake of the latest tools that are available at our disposal. This includes tools such as ultra-portable X-ray systems and artificial intelligence, for example, as well as new technologies such as the 3rd generation LAM assays that we have in order to improve and enhance screening and diagnosis of TB. We also need to take advantage of newer, shorter regimen. For example, the 146 regimen promoted by the Treatment Action Group, consisting of 1-month treatment for TB infection, 4-month regimens for drug-susceptible TB in adults and children, and 6-month regimen for drug-resistant TB. Lastly, we also need to develop and establish appropriate distribution channels for the new vaccines when we have them and as they become available. With respect to innovations and approach, we need to expand engagement with all 3 pillars of the health system. This includes the public system, the private system, and the community health system. Public sector health systems need to be sensitized for better integration of TB, ideally at the primary care level, and particularly into the most common public health burdens such as COPD and asthma management, diabetes, cardiovascular disease, and the most common and relevant forms of cancer such as lung cancer and breast cancer. We also need optimized private sector-based approaches that offer a mutually beneficial value proposition that take into consideration their business objectives while we leverage their strengths to achieve our public health goals. Thirdly, we need to scale up the use of community-based approaches that promote greater involvement of community members and broader use of point-of-care screening and diagnostic tools in order to reach doorsteps, backyards, and living rooms of people affected by TB. The most important innovation in terms of approach, though, is perhaps the urgent need to apply more person-centeredness in all we do in TB. This includes incorporation of the social determinants of health by abandoning paternalistic policies such as DOT, abolishing obsolete notions of having to protect drugs from patients, and eliminating stigmatizing sentiments and language towards persons with TB. With respect to innovations of financing, it is necessary to expand beyond the bilateral and multilateral grant funding with mechanisms of universal health coverage, private sector funding, and even social enterprise cross-subsidization models. Domestic sources such as social contracting and social impact bonds can further stimulate diversification of resource mobilization by introducing market dynamics into the public health domain. With all that said, though, the most important innovation that we will need, in my opinion, is perhaps a paradigm shift in our thinking about TB. Instead of accepting it as a chronic infectious disease and an intractable source of unavoidable death, we need to see it as an indelible embarrassment of our society and a harsh indictment of our grotesque apathy towards the accepted inequity that enables TB to persist. The COVID-19 pandemic has shown what the world, all countries, and each individual can do if there is enough motivation behind it. In summary, we need to steadfastly believe that ending TB is entirely possible and act on that conviction uncompromisingly and with urgency. That is this innovation of thinking that I believe is perhaps the most urgent one that we need. Thank you very much.